I want to start with the doctor first, because when I look at these numbers, Dr. Nangia, and Rajdeep Guleria has said 15,000 cases per day. That's what Dr. Guleria says. But a recent Harvard University study is also claiming there's a direct link between air pollution and COVID-19 mortality. How do you see this? Do you believe that COVID cases, not only the positive cases could rise, but mortality rates could rise because of the respiratory infections that could rise in this season?
Yeah, absolutely, Rajdeep. Thank you for having me on the show, first of all. And, I only feel it's unfortunate that year after year we sit on these kind of panel discussions around this time of the year, hoping that at least next year things would get sorted. But unfortunately, we're back to square one. And this is one of those initial panel discussions that we are having on this air pollution. And this time, it is going to be a disastrous kind of a situation totally because of the COVID pandemic, which is ongoing. So there are various studies which have actually shown, one of them from China, which has shown a direct relationship between the rising number of cases of COVID in proportion with the increase in the PM2.5, PM10, nitric oxide and carbon monoxide levels. Similarly, this Harvard study that you've just quoted has actually shown that not only did the cases rise, but there was also an increase in mortality by almost 8% increase with just 1 microgram increase in the PM2.5 levels.
In fact, just let me tell our viewers that in the 66 regions of Italy, Spain, France and Germany also, 78% of the corona deaths occurred in 5 of the most polluted regions. So it's not just China. The Harvard study found that it's affecting all regions where pollution levels rise. Go ahead, doctor.
Yeah, absolutely. And it's not rocket science basically to understand that why this happens. This basically happens because we know that the polluted air results in the decreased immunological response in the respiratory tract, making an individual more susceptible to infections, the respiratory tract infections. So earlier we used to deal with pneumonias, tuberculosis, viral infections, H1N1s. This year, I think we'll be dealing with more of COVID-19 pneumonias. And this is going to be catastrophic. And then again, there are studies which have shown that in places, again from China itself, where if they were able to control the air pollution levels outside, the COVID-19 cases did come down. And we ourselves have seen that during the lockdown that we had, believe me, Rajdeep, we hardly got any calls from any of our patients complaining of chest pain, complaining of wheezing, breathlessness. In fact, all of them have said that, doc, this season has been excellent for us. And that goes without saying that this is probably because of the lockdown, no traffic on the streets, people not moving out. And if moving out wearing their masks, it actually benefited to most of our respiratory patients significantly. But now with air pollution levels expected to go up, I'm quite sure we're going to land up in a very catastrophic kind of a situation. And that situation is not very far from us today.